Well, good afternoon and welcome everyone to this webinar on the on-site monitoring of the rights of persons with disabilities during the COVID-19 pandemic. I'd like to give the floor to the Secretary General of ENRI, Ms. Debbie Corner, for her welcoming remarks.
Good afternoon, everyone. It is such a pleasure to welcome you all on behalf of ENRI, the European Network of National Human Rights Institutions, to this webinar where we will be looking at on-site monitoring of the rights of persons with disabilities in this time of COVID-19. Over 100 have registered for this event, and we are joined by representatives of NHRIs, National Human Rights Institutions, from Europe and beyond, national equality bodies, NGOs, academics, UN Human Rights, Council of Europe, UNDP. I could go on, but there is a very broad and diverse representation in this webinar. And I'm delighted that so many of you are here, and indeed your presence really underlines the important topic that we are discussing today. It has been clear, sadly, since the beginning of the pandemic, that persons with disabilities have been disproportionately impacted by the public health measures and their implementation. This has further increased the already existing barriers to participate that are felt by persons with disabilities. In order to document this and to act to change the situation, NHRIs across Europe have very quickly adapted their work methods to ensure that they can effectively monitor, promote, and protect the rights of persons with disabilities. This has included some rather innovative practices to ensure that they can continue to be active, including for on-site visits and accessing places of detention. Some of these practices might include using social media, using online tools, using enhanced cooperation with other actors such as yourselves who are present at the webinar today. We all know that closed institutions are not the best facilities and should not be used for a human rights-based approach, but we also know that they are among the most dangerous of places when it comes to COVID-19. Today, we will hear some important advice from the leading European and international organizations working on the rights of persons with disabilities. From the Council of Europe, we will hear from the European Committee for the Prevention of Torture, Inhuman and Degrading Treatment and Punishment, the CPT. From the UN, we will hear from representatives of the Committee on the Convention on the Rights of Persons with Disabilities. And from civil society, we will hear from the European Disability Forum. I'd like to thank you all for joining us today. Next, we will hear direct examples from national human rights institutions across Europe. I'm delighted to be joined here today by colleagues from NHRIs in Belgium, in Czech Republic, and in Georgia. Following these presentations, you will all have an opportunity to ask questions, to give reflections, to give your own advice. And I'm sure that together, by the end of this seminar, we will all be better informed in how to address these issues. We will be inspired by the diverse experiences and ideas that you have. And finally, we will be more resilient and bolstered to continue to act, to monitor, to promote, and to protect the rights of persons with disabilities in these very challenging times of the COVID-19 pandemic. I would like to underline that this webinar is not held only by ENRI, but it is co-hosted by one of our member institutions, the Public Defender of Georgia, which is the NHRI from Georgia. And I would like to underline that for this webinar, there has been incredible leadership and organisation shown by the Public Defender and our colleagues at her institution. And in particular, I'd like to single out Ekaterina, the chair of our working group on the Convention of Persons with Disabilities. And sadly, Nino Yomaria could not join us today, but we are in the best possible hands as Ekaterina Burjanadze will be providing some opening remarks before chairing the first session. So Ekaterina, with all thanks, I will pass over to you, and I wish everyone here at the webinar today success for a very productive and constructive webinar. Thank you.
Good afternoon, dear friends and colleagues, distinguished participants. It is an honor for me to moderate today's webinar and discussion. Unfortunately, Ms. Nino Lomjaria couldn't attend the meeting due to the health reasons, and it has been an amazing experience for me to chair ENRI's CRPD working group, and I'm happy that we organized this webinar to share the experiences, problems and solutions related to the COVID-19 pandemic. The focus of today's webinar will be on-site monitoring of the rights of persons with disabilities during COVID-19 pandemic. We will hear presentations from international organizations and NHRIs and discuss how NHRIs adapted to the changed circumstances, what global and regional actions we are taken, what were main challenges locally or globally, and what conclusions we are drawn by relevant stakeholders. The webinar will be divided into panels. First panel will be dedicated to international and regional perspectives, and second panel will be dedicated to NHRI perspectives. There will be open floor for questions and discussions after each panel, so you can type questions in chat bar during the presentations, or you can intervene at the end of each panel and share your views and questions. I think we can start with the first panel, and our first presenter of this webinar will be Mr. Mikola Gnatowski, the President of European Committee for the Prevention of Torture and Inhuman or Degrading Treatment or Punishment, as well as Professor of International Law at Taras Shevchenko University of Kiev. Since 2010, Professor Gnatowski has participated in and led visits to CPT to psychiatric hospitals and social care centers in such countries as Azerbaijan, Bulgaria, Estonia, France, Georgia, and etc. And he has trained national preventive mechanisms in several countries. Mr. Gnatowski will be speaking about monitoring by the European Committee for the Prevention of Torture in times of COVID-19. Mr. Gnatowski, floor is yours.
Thank you very much, Ekaterina. And I would like to start by thanking the organizers of this webinar for having organized it, and for also managing to attract so many brilliant participants. I see so many people who have registered and who are attending now. And this is very important because the topic we are dealing with is a crucial one as far as our committee is concerned, and this is also my personal opinion. Let me say that the situation of persons who are deprived of their liberty at psychiatric hospitals and at various social care facilities has been one of the most important parts of the mandate of the European Committee for the Prevention of Torture over the 30 years of its existence. And it has been also my personal priority while working with the committee and at the committee, and having the privilege of chairing this committee for over the last 5.5 years. I need to say also that I consider in general the on-site monitoring of these facilities to be absolutely crucial as a tool of exerting pressure on the governments to address the long-standing issues that exist in those facilities. And I completely agree with the opening remarks by Ms. Connor, saying that, of course, the facilities as such are hardly compliant with international human rights law and with European human rights law, and especially when it comes to big institutions and the life in institutions. But this by any means does not mean that they should not be visited by bodies which have the mandate to visit them and to monitor them. On the contrary, I think they need to be prioritized. Visits to this kind of institutions needs to be prioritized. Of course, we have the goal of deinstitutionalization and of proper deinstitutionalization, fully compliant with the CRPD and also with other applicable instruments in international human rights law. But it remains the fact that these establishments continue to exist. And while certain countries have introduced sometimes even quite convincing programs of deinstitutionalization, they are designed for many years, if not for decades. And in the meantime, persons with disabilities staying in those institutions face all sorts of grave issues that really challenge their existence, their dignity, and their inherent rights. Now, as regards the specific context of the COVID-19 pandemic, it was one of the crucial issues for the CPT and also for national preventive mechanisms, whether the monitoring should continue during the COVID-19 pandemic, because of the vulnerability of persons staying at those institutions. Because from the outset of that pandemic, in many countries, including in most prosperous European countries, this pandemic has already taken the lives of hundreds and thousands of persons in those institutions. So the question was whether monitoring should continue, as, of course, one would be concerned about the risk that any external visits might present to the health of and even life of the persons being placed in those institutions. The opinion of the CPT was expressed as early as in March 2020, when we issued our statement of principles related to the human rights of persons deprived of their liberty in the context of the COVID-19 pandemic. And the CPT said that monitoring by independent bodies, including national preventive mechanisms and the CPT, remains an essential safeguard against ill treatment. And states should continue to guarantee access to monitoring bodies to all places of deprivation of liberty, including those where persons are kept in quarantine. But of course, at the same time, all monitoring bodies should take every precaution to observe the do no harm principle, in particular when dealing with persons with pre-existing medical conditions and other risk factors in the context of COVID-19. In our follow-up statement on this subject in July this year, we said that the pandemic hit the hardest in those places of deprivation of liberty where previous recommendations made by the committee had not been implemented. And this relates to the entire spectrum of our mandate, and this includes social care homes and psychiatric hospitals. In particular, further progress must be made in the deinstitutionalization of mental health care. Now, these are the statements, and what about the practice? Due to the fact that the CPT, unlike national preventive mechanisms, is an international body, it had to suspend its visiting activities between the second half, or rather starting approximately from the 18th or 19th of March till the end of June, as transportation within Europe was extremely difficult, or sometimes almost impossible. However, we took a principled decision to resume our monitoring activities as quickly as possible, and we started doing them again already in July this year. Since July this year, the CPT has carried, since March this year, since the beginning of the pandemic, the CPT carried out 9 country visits, 1 still in March, and 8 up to today, I can tell you that there is another visit which is currently underway, and there are more to come. And institutions holding persons with disabilities, of course, there are persons with disabilities in prisons, but also specific institutions such as social care homes and or psychiatric hospitals were not excluded from our program. We visited such facilities already this summer in France, in Bulgaria, and in Bulgaria it was an ad hoc visit which dealt specifically with psychiatric hospitals and social care homes following the very grave findings of the CPT made during the previous visit. We also visited such facilities very recently in the course of our periodic visits to Finland and Monaco. And as I said, this list will be continued this year. So it is obvious that the monitoring must continue, and we should not be seen, I mean the national preventive mechanisms and the CPT, we should not be seen as visitors for whom the access is limited. We are not visitors. We are bodies which inspect those facilities, and we are bodies that monitor the essential human rights, the fundamental human rights of persons who are placed in those facilities. Now, the question is what to monitor. Of course, all the pre-pandemic issues remain valid, and I will not now enumerate them. They're very numerous. But we also have to look at the specific issues, such as the general preparedness to handle COVID-19, the availability of personal protective equipment, the compliance with and the existence and the compliance with the national healthcare advice and applicable protocols within the establishment and externally for the persons who are placed in those establishments. We are looking into such issues as testing of staff and users or patients or residents, whatever the name is used domestically. And also, of course, to the impact of the limitation of any contacts with the outside world, which have been introduced due to the pandemic. And certainly they have exacerbated many of the existing problems. And finally, how to monitor. For us, it is still very much a work in progress. We are working on advice also externally as to how to monitor and what precautionary measures to take. But extremely briefly, I can say that compliance should be made with the national regulations. They should be observed. Now, when we are visiting establishments, we check with the staff what kind of precautionary measures they take, and we take at least the same measures or even more cautious measures. We have all the protective equipment needed, and in cases of confirmed COVID-19 cases at the establishment, we have the reinforced PPE, the reinforced personal protective equipment, and so forth. So, of course, all the delegations have medical members who can assess the situation, who can advise members of our delegations to how to behave in a particular context, in a particular establishment. So there is additional cooperation, advanced cooperation that is needed with the staff and management of the places. But it is, believe me, it is very doable. I have been on 2 of these visits I've mentioned, including the 2 weeks in Bulgaria. And it works perfectly well. You can monitor if you do it properly, if you take the precautions. You are not subjecting persons to risk, but on the contrary, you are helping them and you are dealing with crucial issues that affect their life. And to conclude, I must say that I very much hope that the national preventive mechanisms, which are represented here, national human rights institutions, will continue their work in establishments for persons with disabilities, because they are really needed there, and the CPT stands ready to share our experience and to discuss how to do this work better together. And I remain available for any further questions. Thank you very much for giving me the floor.
Thank you, Mr. Gnatowski. And it must have been very challenging for CPT to monitor the situation at psychiatric hospitals and social care homes in the time of limited mobility due to the pandemic. However, CPT had a very swift response and published statement of principles relating to the treatment of the persons deprived of their liberty in the context of COVID-19, which served as a good guide and helped MPMs and NHRIs in their work. And it was very useful for Georgian NHRI as well, and we used these principles during our monitoring visits. Thank you very much for your presentation. And next speakers, next presentations is by Ms. Rosemary Case and Ms. Mi-Young Kim, members of the UN Committee on the Rights of Persons with Disabilities. Ms. Rosemary Case is an internationally recognized human rights lawyer in the area of disability, and she is vice chairperson of the United Nations Committee on the Rights of Persons with Disabilities. Ms. Rosemary was a design expert on the Australian government delegation to the United Nations negotiations for the Convention of the Rights of Persons with Disabilities, and facilitated the drafting of Article 24 on the rights to education. And Ms. Young Kim is also a member of the Committee on the Rights of Persons with Disabilities and regional board member of Asia Pacific Forum on Women, Law and Development. International advisor, member of the National Human Rights Commission of Korea, and she has been working in the field of disability and women's rights for more than 29 years. Ms. Case and Ms. Kim will focus on the importance of intersectional approaches to monitor the situation of persons with disabilities, and we are privileged to have you with us during these webinars. Ms. Case, the floor is yours.
Thank you very much. Good evening, everybody. It's daytime in Europe, sorry, good day. It's 10:30 at night here in Sydney, so good evening to you, and I'd like to thank the European Network of National Human Rights Institutes and their partners with the Georgian Ombudsman for the invitation to speak today. I appreciate your invitation. It's important that we keep these modes of communication open during such strange times. COVID has exposed the heightened vulnerability and risks to persons with disability that is underpinned by the entrenched discrimination and inequality, and also how the underlying ableism intersects with ageism, racism, sexism, and homophobia, and that results in aggravated forms of discrimination and specific human rights violations that often mean lower quality services, particularly when resources are scarce. Persons with disabilities are often wrongly perceived to be inherently vulnerable, while many persons with disabilities have health conditions that make them susceptible to COVID-19. Pre-existing discrimination and inequality results in situations of vulnerability. The pandemic has revealed that the Convention on the Rights of Persons with Disabilities has not been comprehensively implemented by states parties. The committee was one of the first to be impacted by COVID-19, as we had to cancel our session scheduled for March in 2020. We couldn't review states parties, so we focused on preparing lists of issues and lists of issues prior to reporting for upcoming reviews. We developed a specific question in regard to COVID-19 planning and response measures that was and is being included in relation to questions about Article 11 within the CRPD, a specific article on situations of risk and humanitarian emergencies. So the committee acted in a way to try and fill that protection gap, but it can only go so far. We've also undertaken to raise awareness with states parties We released a joint statement by the committee chair and the UN Special Envoy on disability and accessibility. We released the CRPD statement on COVID-19 and the human rights of persons with disabilities. And we participated in UN media such as news articles and radio interviews. Individual committee members have been raising awareness within their own countries and regions, participating in things like statements of concern around critical care triage mechanisms and ethical decision-making, and providing expert evidence to commissions of inquiry. We also supported statements and policy briefs that were released by the Special Rapporteur on Disabilities and of the Office of the High Commissioner for Human Rights and the Secretary General of the United Nations. National human rights institutions, though, play an important role in assisting the committee's work assisting the committee to do its work, raising awareness of discrimination and inequality and the obligations under CRPD. This is not just in relation to Article 11, but how Article 11 is implemented to address pre-existing inequality with the aim to reducing risk and vulnerability. The UN and committee statements and guidelines would be useful resources in guiding states. Engaging with persons with disabilities through their representative organisations to assist what is happening on the ground and reporting this to the committee for state party reviews, and our response to responding to lists of issues and lists of issues to prior to reporting. NRHIs are very well placed within their domestic arena to be able to assist the committee in enabling it to be able to continue to fill the protection gap. I will now hand over to my colleague, Mi-Eun Kim, who will discuss the impact of COVID-19 on persons with disabilities within Korea. Ms. Kim.
It is a great honor to be here with my respected colleague, Ms. Rosemary Cases today. I would like to express my special thanks to ENNRI for its passion and dedication to organizing this webinar so that human rights experts from Europe but also around the world can gather together to discuss COVID-19 and human rights for persons with disabilities. I'm here today as your collaborator, as a member of the Committee on the Rights of Persons with Disability, but also as a woman with disability living in Northeast Asia who faced the COVID-19 pandemic situation to share my experience in Korea. In fact, I planned to present and discuss with you today the importance of intersectional approach in monitoring the human rights of persons with disabilities in the pandemic, but I have to finish my presentation within 6 minutes, so I think it would be more effective to directly share the experience of Korea's National Human Rights Commission and other human rights organizations to protect the rights of persons with disability in the COVID-19 crisis. Experience of South Korea in the COVID-19. I live in South Korea, close to Wuhan, China, where the virus broke out from the last February. The virus quickly terrorized the people of the Republic of Korea because Wuhan is one of the largest cities in China with active exchange with the Republic of Korea. Fortunately, we had learned a lot from the expenses of SARS in 2007, 2003, and now this experience has contributed in developing national capacity to cope with the COVID virus. So Korea is successfully respond to the COVID-19 with the swift and creative quarantine system and medical service of dedicated medical staff, and above all, active participation of the people of the Republic of Korea in action undertaken by the Central Disaster and Disease Government Office. Now that the number of the impacted people per day is decreasing to less than 100 people, we are living a daily life of maintaining social distance, but without the blockade. The first death from COVID-19 is a man with psychological disabilities. It was a shock for Koreans with disabilities, including me, to hear about the first death from COVID-19 in South Korea, who was reported to be a man with psychological disability, who had been institutionalized for a long time in the closed work Daenam Hospital in Korea. This is one of the worst psychological hospitals. Persons with psychological disability were living in an inhumane treatment environment that only had a mattress on the floor without individual beds and accommodated the patients at one room. At the time, 122 people were impacted there. Investigators were dispatched from Human Rights Centers of Persons with Disabilities and National Human Rights Commission of Korea to the Daenam Hospital, and since then, the Centers for Disease Control and Prevention has conducted a full inspection of 2,415 persons institutionalized at 16 psychological hospitals. Persons with disabilities still live in the closed world in hospital with only limited activities, which heightens their risk to the COVID-19 virus, such as chronic renal failure and decreased immunity. Therefore, regardless of age, the fatality rate is likely to rise to more than 20% among persons institutionalized. Why? Deinstitutionalization is the answer for the rise of persons with disabilities. Human rights organizations of persons with disability in Korea, which are campaigning for deinstitutionalization, responded quickly to the situation. Ironically, COVID-19 revealed the dangerous and tragic situation of the person with disabilities still in less than care institutions, particularly the risk for persons with psychological disabilities. Human rights group of persons with disabilities strongly argued that moving away from closed psychological facilities and living independently in the community is the best way to live safely in disaster situations such as COVID-19. I wrote a column in support of them, and I also advised the Korean government that the institutionalization is a way to cope with future infectious disaster. The Committee on the Rights of Persons with Disabilities has stressed and called on state parties to the convention to reinforce measures of deinstitutionalization of persons with disabilities, accelerating the release of persons whose provision of support in the community is ensured through family and or informal network, and increase financial resources to expand support service in the community. The importance of the cooperation and advice provided by the National Human Rights Commission of Korea. The doctors and human rights activists with disabilities had a different approach on how to address the situation of persons with disabilities during the pandemic. Doctors in the psychological ward hospitals suggested improving the treatment environment of hospitals and increasing the number of doctors. On the other side, human rights advocacy from Disability Society pointed out that the environment in which people with psychological disabilities collectively live in residences is the fundamental problem, and strongly demanded that all institutions must be in the institutionalized as well as long-term psychiatric hospitals. The role of the National Human Rights Commission of Korea was crucially important and powerful in this internal debate. The NHRI of Korea advised the Minister of Health and Welfare, among others, to ensure and facilitate regular monitoring of rights advocacy organizations for persons with disabilities in still existing institutions, and to ensure that the National Mental Health Plan reflects the institutionalization plan and the development of support in the community for persons with disabilities. The experience of COVID-19 has showed us the importance of cooperation and joint work between human rights organizations and the National Human Rights Institution for protecting and promoting the rights of persons with disabilities. In addition, the National Human Rights Commission has contributed to increase the accountability of the government in giving effort to the UNCRPD and the recommendation of the Committee on the Rights of Persons with Disabilities again. Question brought by COVID-19. Who will be the first to be saved in the disease? A child of the future generation? What about the young men and women? Should a person with disability and older person give up their lives and wait for death? It is inevitable that only the so-called strong will survive. Are all humans really dignified? Should a person with disability and older people be left to die at the facility due to virus infection? Statistics show that there is a 87% or more chance of acquired impairment after birth. Disability and aging are natural life process that all human beings can meet at any time. No one is exempt. I believe that persons with disabilities and older persons with disabilities are part of the diversity of human beings. Thank you for your listening.
Thank you, Ms. Case, Ms. Kim. Indeed, intersectionality is very important to fully grasp the issue related to the rights of persons with disabilities, since many social factors are at play in this area. So it was very interesting to hear about your experiences with the NHRIs and with the government of Korea, and I think that we can draw important conclusions from your work. Thank you once again for your involvement. And before we move to our final presenter, I would like to encourage you to ask questions or to type in chat during the presentations. And after this panel, we will have a possibility to have a discussion. Our final presenter is Ms. Anna Pelaez-Narvaez, Vice President of the European Disability Forum and Chair of the ADF Women's Committee. She's a women with disability and disability rights activist, and she's Executive Counselor for International Relations and External Development at the Spanish National Organization of the Blind, responsible for gender affairs at the Spanish Council of Representatives of Persons with Disabilities, former member of the United Nations CRPD Committee and member of the CEDAW Committee. She will present in a capacity of Vice President of the European Disability Forum, and she will talk about the role of ADF in monitoring the impact of COVID-19 pandemic on persons with disabilities in Europe. Ms. Anna, floor is yours.
Thank you very much. Can you hear me?
Yes.
Okay, thank you. Thank you very much. On behalf of the European Disability Forum, we would like to express our gratitude to Henry for inviting us to this important webinar in relation with people with disabilities. EDF, the European Disability Forum, is the umbrella organization representing 100 million of people with disabilities in the region, in the whole Europe. We have members in most of the countries of Europe, and also we have a European organization as members of EDF. EDF is leading by us, people with disabilities, and also our families through our representative organizations. And EDF is also consider the diversity of disabilities. So we are talking here and we are present of people with intellectual disabilities, psychosocial disability, deaf, blindness, all types of disabilities. I would like to express also the commitment of EDF in relation to implement an intersectional approach about the different populations of people with disabilities most vulnerable or most discriminated, such as, for example, women and girls with disabilities, young people with disabilities, LGBTI plus people, or for example, refugees, elderly people, etc. Of course, when we are talking about the COVID-19 and people with disabilities, it's already recognized that we are in a very bad position. The impact of the COVID was terrible in relation with our population. I must say that even now, new forms of discrimination, new forms from this moment of the pandemics are especially affecting people with disabilities. But here, especially, it's very important to take into consideration the situation or the specific situation of people with disabilities living in institutions. In institutions in Europe. We don't have exactly data about that, but the estimation is around 1 million of people with disabilities are living in institutions in Europe without any consultation. This is the situation. But in this moment, due to the pandemic, many institutions, especially institutions where these people are living, are closed. And we cannot go and to monitor any situation because they want to protect the people living there. But I would like to especially pay attention about the situation, or to address your attention about the situation of people with disabilities living without any consultation in this moment, for example, in psychiatric hospitals, in prisons, in centers for example, refugees or asylum people, where they don't know in the centers anything, in many cases, about how to attend, how to protect, how to consult people with disabilities in these centers. I would like to say that, of course, people with disabilities are more exposed to have the COVID-19 because some different situations. For example, in general, there are no consideration of people with disabilities where we need to protect the global population. There are no, for example, personal protective equipment for example, the people who are in this institution with disabilities, or for example, people with disabilities living in other places. There are no, for example, this equipment. For example, we have to say that the fact of the not accessibility of information, or for example, the barriers of communication, it was and it is in this moment also part of the situation that and the obstacles that many people, especially in rural areas with disabilities, have to face every day, even in this moment. I have to say that, for example, the access to healthcare services are, for many people with disabilities, nearly impossible, especially where in the situation is quite complex, such as, for example, in this moment in some part of Europe. Talking about the statistics, I have to say that, for example, in many places there are no consideration of people with disabilities in the national statistics about the COVID. That is something that we have to denounce. But for example, when we are looking at the statistics of from Slovenia, for example, the 81% of the deaths in these countries were of people living in institutions, not people with disability, but just people living in institutions. 81% of the death of the countries. But I would like also to say something about my country. For example, here you have some data in my presentation. The data are already old because the situation here is very complex in this moment, so the data are changing. But I have to say that just they consider the death of or for example, the contamination by the COVID when you have already a test which prove this situation. But people with disability had a lot of problems to get the test. So we are more effective than the statistics prove in this regard. I would like also to say that, for example, in my country, thanks to CERMI, which is the national organization representing people with disabilities, CERMI, thanks to them, for example, now the disability indicator is already considered, for example, in the public statistics. And for example, thanks to CERMI, now the access to information and communication is easier. But I have to say that also CERMI denounced from the beginning of the pandemic, not just issues linking with health, but also other issues very important for people with disability. For example, talking about access to education during the pandemic, we must say that the fact, for example, not just in Spain, but also in many other countries in Europe, the government didn't consider for example, the inclusive or the virtual access to education for children with disabilities during the pandemic. Or for example, now in many places, people with disabilities cannot work because there are no consideration of accessibility, for example, in the virtual work, in the work by internet. So many people with disabilities are also affected by this situation. Also, I have to say that during the pandemic, for example, especially in the most critical moment, people with disabilities try to go out due to their own disabilities, and they were fined by the police, even if in the legislation and the rules for the pandemic were considered the possibility to go out for people with disabilities. So there are some problems in this regard. What is the role of the Gpos during the pandemic? For us, crucial, because it was the Gpos, in many cases, the only answer, the only possibility for many people with disabilities and their families. But they didn't receive any extra resources to develop all these services during the pandemic. I have to say also, for example, there are not consideration to the consultation of many organizations of people with disabilities in order to guarantee that the new services are already inclusive for people with disabilities. But it's true that there are many creativity, new innovation in the world of many Gpos in this regard. In relation with the EDF at the European level, we have said that EDF was next to every national council of disabilities in our region all the time, it just in relations to offer capacity building for them, offering also the possibility to receive any kind of support, also sharing information. And in this regard, for example, EDF is already preparing a report on the impact of people with disabilities during the pandemic, available by the end of the year. In relation with national organizations, I have to say that, as I mentioned before, new possibilities, new activities are already in the Gpos agenda at the national level. I would like to present, for example, one example. CERMIC Women's Foundation, which is the platform representing women with disabilities and girls with disabilities in my country, in Spain, where developed a special webinar, You Are Not Alone, which offer the possibility to contact all women with disabilities, mothers of people with disabilities, girls with disabilities, all every Wednesday, to monitor how is the situation. Because in relation with violence against women with disabilities and girls with disabilities was terrible, not just in Spain, but also in all the countries. And in this regard, for example, CERMIC Women Foundation developed an instrument to just an app to denounce this situation, even in this moment of pandemic. So, and which is available also for all of you. Finally, our 5 recommendations to the national human rights institutions from EDF. The first, we consider your work very important. And in this regard, we think that it's very substantive, important, just to monitor the situation of people with disabilities living in institutions. This is really important in residential settings, in psychiatric hospitals, in prisons, in refugees centers, for example. This is crucial. The second recommendation, we think you have to consult, always consult Gpos, consult our national umbrellas organizations of people with disabilities, because they are going to say what is needed really. So this consultation is fundamental. The third, it's also very important to pay attention to the most vulnerable group of people, especially women and girls with disabilities, children with disabilities, LGBTI plus, for elderly people with disabilities. This is fundamental. The fourth recommendation, I think, is needed also to take all this information that you are providing to offer this information to the CRPD committee on the United Nations. For me, it's a wonderful privilege to share this panel with Rosemary and with Millo. Thank you very much. But this is really fundamental to offer this information from you as a National Organization of Human Rights to the CRPD committee. And finally, our last recommendation from EDF is just to perhaps offer our expertise on people with disabilities, the EDF expertise, to work together. I think perhaps we have to see how we can work more in the same line, the national human rights institutions at the national level and also at the European level with the EDF and its members. Thank you very much for your attention.
Ms. Anna, thank you very much. And I want to add that we are very glad that you were able to present your perspectives today. It is very important to take into account experiences of NGOs and CSOs to see the issue from different angles. Indeed, you have been very active throughout this month, especially in the direction of sharing information and recommendations. And thank you very much for today's presentation. Dear friends, we have some questions in our chat, so due to the limited time, I will read just a few of them, and then we will try to provide you written answers from our speakers. So first question is to the committee members, and the question is about the working group which was announced to establish about the institutionalization. And question is if NHRIs and equality bodies in the how do you see the role of NHRIs and equality bodies in the working group, including during the pandemic, if there is any possibility of cooperation in the working group of deinstitutionalization, which will be created in CRPD committee. And another question is about how we can persuade states to allow visits to continue, as members of the public provide an important role in monitoring the well-being of friends and families. And if you have any suggestions how to persuade our states to allow visits during the pandemic and to continue this kind of visits. And third question is about strategies for NHRIs and NGOs, how they can how they can collaborate and how they can provide proper financial funding from the government and assistive devices for citizens with disabilities. So this question, I guess, is towards Ms. Anna, if she can share NGO perspectives, how they can be assistive for citizens with disabilities, I mean NGOs, and another two questions maybe other speakers can answer, including members of the committee. Ms. Anna, maybe we can start from you.
Hello,
Yes,
can you hear me?
We can see you and we can hear you perfectly.
Okay, sorry, because I'm not very good at the using of technology.
No problem, that's perfect.
Okay, no, thank you very much. I think the role of the organization of people with disabilities, the role of organization of National Institution of Human Rights, service providers are fundamental. We are here all together working in the same way. And I think it's fundamental to ensure this coordination. And it's also fundamental to report about this situation to the CRPD committee. The CRPD committee and the Convention on the Rights of Persons with Disability plus the optional protocol is a key instrument to define our rights. And I think we need to present and to offer to the CRPD committee through the consideration of the different states report, but also through the optional protocol, is fundamental present this kind of this kind of discrimination for our fundamental rights. For example, in relation with triage, many people died because with disabilities because they were outside of this possibility. And we would like to say that we have instruments to denounce this situation, and this situation must be considered by the CRPD and the other legal bodies to denounce and also to condemn these practices, because all these pandemics are a special lesson for all of us, and the most vulnerable people are excluded for consideration and excluded for equality and also for many areas of life, not just health, but also for education, for employment, for many others. And this is my answer. Thank you.
Sorry for some technical reasons. Thank you, Ms. Anna. And another question is to committee members about the working group and possible involvement of equality bodies and NHRIs in this process. So, Ms. Rosemary and Ms. Kim.
Thank you. The question is about the working group that's been established by the Committee on Deinstitutionalisation. As I iterated in my presentation and Ms. Kim indicated in her presentation, the importance of knowledge from the ground, from the domestic situation where you've got the nuanced understanding of what's going on is incredibly important for the committee and the committee's work. We need to engage with states in a meaningful way that talks to their complex situations and their policy context. And so it's only with that informed knowledge that monitors such as national human rights institutions, it's that information, that data, that evidence that is so critical to what the committee can do. And so if NRHIs have got good inclusive mechanisms of monitoring, if they've got good partnerships with DPOs and are engaging meaningfully with DPOs, the quality of information that comes through to the committee is very important. And so it's the relationship, not just between the working groups, but not just the working group on institutionalisation, but our other working groups, our standing working group on GANRI, but the other working groups that we have and the other working methods that we have, that engagement and information sharing is critical to the work that we do. And we would encourage NRHIs to engage with us through ENRI and through GANRI to set up mechanisms to enable that communication flow.
Thank you, Ms. Rosemary, for your answer. We have some questions, but because we are limited in time, I suggest you that we will collect these questions and we will provide written answers later on after this webinar. Unfortunately, we do not have enough time to ask or answer all questions, and sorry for that. And also, I would like to suggest you to have some technical break, 5 minutes, and we come back in 5 minutes. Thank you very much. You can stay online, you can just have this break, and after 5 minutes we continue. Dear colleagues, I think we can start our second panel, which will be dedicated to NHRI perspectives. And 3 NHRIs will make presentations in this panel. In Interfederal Center for Equal Opportunities and Opposition to Racism, UNIA from Belgium, Office of the Public Defender of Georgia, and Office of the Public Defender of Rights of Czech Republic. First presentation in this panel will be Ms. Carol van Basseler from UNIA. After 10 years at the Brussels bar, Ms. Basseler joined the UNIA Disability Unit in 2015 as a policy officer. UNIA, recognized as an NHRI, is the equality body and the CRPD monitoring body in Belgium. Carol is one of the legal support in her team and works mostly on inclusive education issues and ideas. Ms. Carol, floor is yours.
Thank you very much. I hope everybody can hear me. Yeah, first of all, it's an honor for me and for UNIA to be part of this very important webinar. And I would, of course, thank our colleagues from Brussels, Henry, and the Office of the Public Defender of Georgia for all this organization. I'm going to try not to be too expensive because I see it's quite late, but can you just tell me if you can see the presentation, first of all?
Yes, Carol, we see presentation.
Thank you so much. I will today try to explain how we did here in Belgium from UNIA to manage the situation about hearing persons with disabilities living in closed facilities and institutions. What were our challenges, the need of for monitoring mandates, and I will finish by a short, very brief presentation about the pandemic, because the first thing interesting to know about UNIA is that, as it was mentioned, we are NHRI, we are an equality body, we have the national monitoring mechanism under CRPD, but we do not have the mandate for monitoring closed facilities under optional protocol to the Convention Against Torture. And the other things to know is that we are an interfederal center or institution. That means that UNIA is active in Belgium at the federal states level, but also for all the regional and communities level. And so about institution and closed facilities, we very soon could see in our mission for monitoring CRPD that we are facing a lot of difficulties in regard with persons with disabilities living in institution or closed facilities. We quickly realized the need of monitoring such places. And why do we realize this need for monitoring mandate? As you know, persons with disabilities in institutions, closed facilities, are more vulnerable, they are isolated, there is a lack of control, there is less attention for them from the authorities and for the public in general. And so another important thing that we can often see in our work, that there is a gap between mental health and disability. So of people doesn't know that mental health is concerned about the rights provided in the CRPD. And another thing, another difficulty, another challenge was the difficulty to hear the voice of persons with disability directly. So, of course, we tried to have their voices through their representative associations, relatives, NGOs, staff, and so on. But we miss to have their voice directly. Another thing is that we can see that we do not have a lot of reports about discrimination or about violation of the CRPD in UNIA. But we know there are a lot of problems, but we do not receive reports. And the last thing, very important, and it was mentioned before, is the difficulties to collect data and from the authorities or from other partners. And so with this concept, so we are facing some difficulties. We try to act and different with 3 different ways. In regard with institution, first, for example, we decided to work a lot on Article 19 CRPD. So we could see that a lot of people didn't know this article, and so we decided what was 2 years ago, sorry, to focus on awareness raising about this article. We are still in process in it, but for example, what we did was to translate the General Command number 5 in easy to read in French and Dutch. So the idea was to promote this the desinstitutionalization and independent living. Another way for us to try to hear the voice of persons with disabilities in institutions was to work on the right to vote. So we hired last year 2 people, one French speaker and one Dutch speaker, to work on a study on the right to vote with a focus for persons with disabilities, with intellectual disabilities, and with mental disorders. And so our colleagues interview more than 100 persons with disabilities, included persons living in residential service, in psychiatric hospitals, and in institutions, in families, and so on. And they also interview more than 20 experts on this issue. And we just published a report on this study this year, so at the beginning of this year. So that is our work in progress for institution. But another issue is the optional protocol to the Convention Against Torture, because Belgium signed the convention like more than 15 years ago, but Belgium did not ratify it. And so we do not have in Belgium a national prevention mechanism. So UNIA frequently recommend to the authorities to ratify the protocol, and of course to establish this mechanism, because it's a crucial issue in Belgium. Now, currently there is a working group working on the implementation of this mechanism. This working group was built by the Minister of Justice. UNIA is part of this working group with other institutions working on the rights of persons deprived of liberty. For example, the Belgian Federal Migration Center, the General Delegate for Children's Rights, the Federal Ombudsman, and so on. And so the discussions are in progress. UNIA is takes active part in this, and UNIA's will is to contribute for this future national mechanism, mostly for the all the issues concerning persons with disability. So we are waiting, and I hope that very soon I will be able to let you know how we can be part of this process. And a last action we made very recently is the decision from UNIA to create a new internment, we call it cell, that's a team in our disability unit. So because of our lack of experience, of information on this topic, we decided to hire one new person to work on this. And so now we are lucky to have one colleague working on this issue 2 days a week. And so far, she have met more than 30 actors working in the field of psychiatry, like psychiatrists, doctors, families, of course, NGOs, academics, and so on. She also had 1 week training course on the control of places of deprivation of liberty. And since the beginning of this year, since January, we received the permission from the Ministry of Justice to visit closed facilities, but only the closed facilities depending on the justice system, so the federal system. It's one of our challenge that we have to face with, and I will explain it later, is that in Belgium is quite complicated with all the organization. But so now, since this year, we can visit prisons and psychiatric annex in prisons. We received this permission in January. We were not ready, and the crisis happened, and so far we do not have visited any closed facilities, but it will be the case for the next few weeks. What we want to do with this, with our internment cell, is to first is to understand how all these places work and specify our mission, because we are new in this area, and we really want to do the link between our mission and, of course, the CRPD. And of course, we want to work in parallel with the other institutions in Belgium that already work for the rights of persons in internal places. And so, as I said, we faced a lot of challenges in order to make it this monitoring concrete. Of course,
Ms.
it's
Carol, sorry for interviewing. Can you please wrap up, because we are a bit. Can you wrap up in 1 minute, please?
Sorry, can you repeat?
Time. Yes.
To be shorter, that's it?
Yes, please.
Yeah, okay. Sorry, just I will maybe finish the presentation with this focus on the COVID-19 challenges, and I will not explain all the concerns for persons with disabilities in closed facilities. We already mentioned them, but just to let you know that even without our monitoring mandate, we try to hear the voice of persons with disabilities in closed facilities. For example, we work a lot with NGOs, with family, so we work in partnership with them. We organize an online consultation of persons with disability and their families, and we also participate in a federal task force, and we bring the attention of the authorities on the internment issue. So of course, I stay at the disposal of the participants if they want more information, and I really want to thank you again for the invitation. Thank you. I let you the floor.
Thank you very much, and sharing your perspective is especially interesting since you recently started to implement the monitoring mandate, and I wish you effective implementation of your new mandate. Dear friends, once again, I would like to deeply apologize that we didn't have enough time for discussion in our first session, and my special thanks to Mr. Gnatowski for providing written answers. Our next speaker is my colleague, Mr. Georgi Burjanadze, Deputy Public Defender of Georgia. Mr. Burjanadze is a lawyer and has extensive experience in working in the direction of human rights, including and not limited to working in the Office of Public Defender. He had been coordinating various programs and projects dedicated to human rights protection, and among other structural units, Georgi leads, coordinates, and supervises activities of the MPM. Georgi, floor is yours, and we have 8 minutes for your presentation. Thank you.
Thank you, Eka. Thank you for this introduction. I welcome all the guests. It's really great honor to be present here together with this all valuable speakers from different parts of the world. I'll try to speak about the on-site monitoring of the rights of persons with disabilities during COVID-19 pandemic. I'll try to describe some of the activities which we have been undergoing through, and if you have any questions, I'll be happy to answer them. Well, we all know that pandemic had really disproportionate effect on everyone, but including but especially to the rights of persons with disabilities. It was really crucial at some point. Persons with disabilities placed in closed facilities, residential institutions, and nursing homes have been named among those facing even greater threats under the most severe risk of neglect and rights violation. People deprived of liberty, such as people in prisons and other places of detention, are likely to be more vulnerable to the coronavirus outbreak than the general population because of the confined conditions in which they live together for the prolonged period of time. The same goes, of course, to psychiatric institutions where some beneficiaries are practically detained for life, unfortunately. We all know that the institutionalization is not the process that is going smoothly or promptly in many countries, including our beloved Georgia. Large residential institutions where persons with different disabilities, including mental health problems, are placed, including mental health problems, are placed, continue to exist. People with disabilities without shelter are also forced to live in such institutions, and in better case, community houses. Based on this background, Public Defender of Georgia used to regularly conduct systemic monitoring and on-site visits of such places. However, we, as any other NHRI, had to adjust our work to the new circumstances introduced by the pandemic. It was essential to become accustomed to become accustomed and create monitoring mechanisms to safeguard both prevention of disease and human rights protection of persons with disabilities. While the need of monitoring or protection of the rights of persons with disabilities in closed facilities was also emphasized by UN Subcommittee on Prevention of Torture to state parties and to national preventive mechanisms. SPT suggested that the visits should not discontinue and public health threat should not be impediment to the visits. But of course, we as an MPM should follow some of these public health requirements. In order to minimize the risk of infection and prevent the spread of virus, it is critical to have a guiding document on necessary protective measures to be taken during the monitoring visits in the midst of the health crisis. As a result, we have developed a special guideline. The overall objective of this guideline and the rules is to minimize the spread of the virus and protect both monitors and persons in closed facilities. A general obligation in the rules underlines that the monitor is obliged to fully obey and follow recommendations and the requirements imposed by the government and World Health Organization concerning epidemiological situation. The rules specify a list of necessary individual protective equipment to be used during the visit, such as mask, gloves, gown, medical eye protection, shoe protection, disinfection solution, hermetically sealed container, or some bag intended for utilizing of special means. Well, nobody can recognize when we enter the prison we are so well dressed there or any other closed facilities, because we use maximum protection when we enter the closed institutions. We developed the so-called three level of protection. We have minimum, we have medium and high risk security levels, and we try to adjust to different circumstances. As a minimum, we use the medium protection level when we enter any closed facilities. There are precise and detailed instructions on the use and order of use of each and every protective equipment according to safety levels. We are afraid of spread of the virus, and of course we take care of all of the beneficiaries whose rights we are monitoring and protecting, but also we do take care of our staff members who are really important for us, and we will also think of their rights, and from that perspective, this guideline is important for us also. Before any visit, there is a requirement of checking the temperature, because we know that temperature is one of the symptoms, and if the person has temperature above 37, when the person is person cannot go for the visit. Our monitors. The rules are quite detailed and clear, making it easier to protect, to observe and protect ourselves and others from the contamination and spread of the virus. Based on the instructions and methods and all these new rules and guidelines, we conducted number of visits at prisons, 24-hour daycare institutions, psychiatric institutions, and newly established care services for persons with mental health problems in variety also. So our main approach is to monitor the situation in those institutions from general perspective, but also to look at, we are calling it COVID-specific issues. For instance, how the sanitary condition is being observed, how the hygienic rules are observed, and how the special preventive measures are taken on spot. So we try to have broader and specific look at the visits. It is noteworthy that since lots of people have been placed in Georgia in quarantine places in order to avoid the spread of COVID-19, we found it necessary to draft a special methodology for monitoring the human rights situation of people placed in quarantine places, which we are basing on relevant international standards, including SPT recommendations, and we pay special attention to the rights of persons with disabilities, their needs and protection issues. Based on this methodology, we conducted special monitoring. This monitoring was conducted based on the telephone interviews, based on internet interviews. We did not went on spot to quarantine places, and we developed a special report. Well, as a result of the monitoring, a number of problematic issues has been identified and relevant recommendations have been drafted. In terms of persons with disabilities, it should be mentioned that Public Defender has emphasized the need for provision of relevant psychological support to children with autism or other behavioral problems. Additionally, Public Defender indicated that it is important to evaluate whether such person should be moved to self-isolation or should stay at home in a more familiar environment, which is much better for them from a medical perspective. Public Defender's Office advocated for a necessity to allow such children to walk in fresh air. The recommendations were partially shared by the state, and according to new amendments to the relevant ordinance, persons with disabilities generally and families with children with disabilities, autism or behavioral problems may not be quarantined and may self-isolate in themselves. In case of emergency or where necessary, PDO is ready to conduct further monitoring of any closed facilities or boarding houses during pandemic. Observance of safety measures make it possible to protect the human rights of those who are in special need of protection. I'm really proud of my colleagues, together with whom we have conducted dozens of monitoring in the circumstances where nobody was feeling safe, and we never hesitated. We have conducted many with this, and we still continue that epidemic situation will help us in this future work. I also want to thank the donor organizations who helped us from many perspectives in conducting the visit. Especially, I would like to underline UNDP and Open Society Georgia Foundation. That was all. Thank you for your attention. I hope I did not speak too fast for the translators. My apologies for this. Should you have any questions, I will be happy to answer them. Thank you.
Thank you very much, Georgi. And I also want to add that it was very challenging for us, but we managed to conduct effective monitoring visits in different facilities. And thank you for your intervention. The last speaker of our panel is Ms. Zuzana Durayova, who works as a lawyer in the Department of Rights of Persons with Disabilities in the Ombudsman's Office, which is the monitoring body of CRPD in the Czech Republic. She also participates in the visits of social care institutions or psychiatric hospitals undertaken under OPCAD. Ms. Zuzana, floor is yours.
Thank you very much. And thank you for all the very interesting participants and all the interesting speeches that have been before me. First of all, I want to say I've been having some problems with my connection. So if in any case, if I'm not going to able to finish my presentation, I really apologize. I don't know what's wrong. What I wanted to speak about is the visits that we undertook. These were special visits concerning the COVID measures that we did. So they were a little bit shorter and more focused than the visits that we normally do under the NPM. There were 12 visits overall in different kind of institutions. So including 2 prisons, 2 immigrant centers, 4 institutions for children, but we also did visits in 2 psychiatric hospitals and 2 social care institutions. These are the ones that I want to speak about. overall, the situation was not too bad. There was no ill treatment in any of the social care or psychiatric institutions that we have visited. The situation was more, the problems were maybe stemming more from confusion or lack of information that was in the beginning of the pandemic, and also some of the measures that were imposed by the Ministry of Health and other ministries were sometimes not clear enough. That's why the institutions didn't really know what to do. So these were mostly problems concerning some lack of interpretation of these measures, or lack of measures whatsoever. This was the problem, for example, in children's institutions, where it took some time until the ministry issued some kind of guidelines. The situation in social care institutions were a little bit better than in psychiatric hospitals. What we found was that the clients were quite well informed, or the institutions were trying to inform the clients about the pandemic, about the measures and the restrictions. They were also in social care institutions, they were trying to enable the clients to contact their relatives via internet, via like tablets and so on, which of course was not really good for all the people, but especially people with dementia and Alzheimer's, it was a bit problematic, but at least in the staff of the institutions were trying. The staff also, some of the volunteers for events of quarantine. They said that they would stay in the institution in case the quarantine was imposed. However, we in the institutions that we visited, there were no positive clients or patients, so we didn't really encounter the situation of quarantine. The problems, the biggest problems were, I mean, both in psychiatric hospitals and social care institutions, were the lack of visits from, or the ban on visits from relatives. It was also like one of the reasons why this is so bad, let's say, is that the protective measure, or the measure that was issued by the Ministry of Health contained some exceptions from the ban on visits, but these exceptions were only for people with restricted legal capacity. So the measure said that the institution must allow guardians to visit their clients. However, because in Czech Republic we also have different kinds of supported measures other than guardianship or other than restriction of legal capacity, these were not really the measures that the ministry thought of, and they didn't put it in the measure as an exception. So in practice, what we encountered was that a lot of institutions just banned all the visits and didn't really look into who was the guardian or who was just a family member and so on. So this was a problem. The other problem was the inability of clients or patients to leave the institution. In case where the institutions had some kind of garden or some outside space, it was a little bit better because the clients were able to just go out. But in case there was nothing, then the people were basically locked in for some of them were locked in for like 2 months, which was a very long time. A big problem was also in psychiatric hospitals in case of voluntary patients, because even though the patients were there voluntarily, the hospitals considered leaving the hospital a violation of their interim measures, and then they were threatening the patients for discontinuation of care if they decided to leave. So they were, in fact, they were involuntary patients, let's say, although de jure they were voluntary patients. Also in psychiatric hospitals, what we considered a big problem was that during the proceedings, so the proceedings on involuntary hospitalization, the courts decided not to visit the patients. The courts, although the law says that every time that the court must hear the patient before making a decision on involuntary hospitalization, the courts just decided not to visit the patient. So this is one of the recommendations that that the Ombudsman was speaking about with the Ministry of Justice. One more thing, maybe one more problem that we encountered was, or maybe two. One was the lack of activities, because the restriction was on group activities. So in case the clients or patients were the only activities they had were like some kind of group activities during the day, and they were banned to do this, they didn't really have any alternatives. So they didn't really have a way to meaningfully spend their day. They couldn't, especially if they couldn't even go out. What we didn't encounter, but what we considered or we found problematic was that some of the hospitals or staff of the hospitals, when they were talking about some policies they had in place. As I said, we didn't meet any client or that was positive on COVID, but they said that in case they were positive, these clients might have been put in isolation rooms for quarantine because they didn't have enough rooms. Which we found is highly problematic, that they would put the patient only because he was suspected of having COVID in isolation. And also there was some kind of misunderstanding whether the patients who stay in the same room could be considered a family unit, as the measure of the Ministry of Health that said that in case people were like family unit, or they didn't have to have a face mask. So some of the hospitals didn't really know whether the patients, if they spend like a lot of time together in one room, if they should be, they should have a face mask. So that's overall maybe about the COVID visits. There was a follow-up discussion with the ministries, and many things were actually changed, but we don't know, because I don't know if you know about the situation in Czech Republic, because it's the restrictions were not so strong, and in the summer, like the face masks were not mandatory. However, the situation at the moment is getting much worse, so we don't know. So there might be a lot of much more restrictions in the future. However, we have had a discussion about whether to conduct the monitoring visits, and like the CPT, we decided that we're going to continue the monitoring, because this is important to do that even in the time of COVID. And we've developed some guidelines very similar to the CPT guidelines or the Georgian guidelines on how to protect the monitors, and especially how to protect the people in the institutions from the disease. So yeah, that's about it. Thank you.
Thank you very much, and it was very interesting to hear your take on challenges and issues brought by the COVID-19 pandemic. And it has been challenging, I think, for all of us. Mm-hmm. However, I think that we can still draw from each other's experience and adapt to any changes that will be in the future. Now I think we can move to questions, and the first question is to Mr. Georgi Burjanadze about if he can elaborate more about the 3 different protective packages that was mentioned in his presentation. Mr. Georgi, floor is yours.
Thank you. Thank you for this question. I was a bit in the rush trying to fit in the time, and I didn't go into too much detail. Well, this internal guideline which we have does elaborate so-called the 3 layers. One is the first one is a minimum requirement, which is kind of medical mask and the gloves. Second one is medium, which is medical mask, gloves, and the gown, and the third one is the highest level, where with mask, gloves, and gown. Additionally, there is eye protection, which is medical goggles and face shield, and additionally we have the shoe protection. So this the third one is in institutions. Will be used in, for instance, in prisons, because there are so-called 2 spaces in Georgian prisons now. One is the space where employees go and go back to work, and other ones there are people and other employees who are in contact with prisoners. They don't have communication with outside world. So since in Georgia there is no case in prison, for instance, of COVID-19, we try to use the maximum protection in order not to bring our COVID-19 there from outside the world, because we enter prisons, for instance, on the morning, and we left for the evening, and there is a chance that from outside world we bring some virus there, and for that reason we try to use the full protection there as such. Also, in any institution and any facilities where we have direct contact with these people, we try to use this protection as such. There is no such kind of protection requirement, for instance, in temporary detention as isolators. And for instance, when we go there, we use the medium protection, equipments there. The reason is that in temporary detention isolators, the person is placed for only a few hours, and it's not, let's say, COVID-free space. It is a space where any new detainee might have the virus, and for that reason, in this scenario, we don't use this maximum protection unless we know that there is a person who does have symptoms there, or the person does have COVID-19 there. The difference between layers is that we fully understand that it is not easy to conduct the monitoring equipped with all this. It is really problematic, and especially it was really difficult during the summer when it was extremely hot. So we try to use the whole idea and philosophy is that we use maximum needed protection to the facility we are going there. I hope I managed to answer your question.
Thank you, Georgi, very much. And there was another question, if we will share presentations with the participants, and of course we will send an email to all participants with presentations, link of recording, and written answers to questions. We do not have any other questions, so first of all, I would like to thank our interpreters for their wonderful work, and let me express my gratitude for your active participation in the webinar. I hope that it was interesting and fruitful, and everybody had the opportunity to influence and share their views during the webinar. I want to once again thank our speakers for their excellent presentations, and Henry for the support they have given us to organize this webinar. Thank you very much once again, and have a nice day. Thank you.